The Kenya Master Health Facility Registry, the one website that allowed citizens to check whether a hospital was real or a fraud, has vanished. Hours after Health Cabinet Secretary Aden Duale issued a statement on August 25, 2025, the entire site went dark. Kenyans are now asking, was this a technical glitch or a deliberate move to hide evidence in the billion-shilling ghost hospital scandal that has rocked the Social Health Authority?
Kenyans look so smart until you come closer. Wakenya wanakaga werevu sana hapa East Africa. Until ukae nao hivi una realize shit, huyu nini huyu? Hizi fisadi zinaendelea, SHA, SHIF, sijui nini. Kuanzia KEMSA last year but one mpaka wa leo. Munasemati, the president should. Which president? Ruto. Should do what? Crack? A whip?
The Master Health Facility Registry, known as KMHFR, was the official government database that listed every licensed hospital and clinic in Kenya, public or private, rural or urban. If a facility existed legally, it had to be there. For years, this registry gave Kenyans a way to independently verify hospitals and expose suspicious ones. But on August 25, 2025, Monday, when you type kmhfr.health.go.ke, all you see is an error page reading, "This site can't be reached. Check if there is a typo in kmhfr.health.go.ke. DNS probe finished. NX domain. The digital footprint of the registry has been erased." Why now? The timing is everything. Just days ago, investigative reports revealed how billions of shillings under the new Social Health Authority, the scheme that replaced NHIF, was siphoned into so-called ghost hospitals, places that don't exist. Clinics that are nothing more than thickets and abandoned buildings, yet money flowed to them in the name of patient claims in billions. At the center of the storm is Aden Duale, the health CS who on August 25th announced the closure of over 700 facilities, many flagged as fraudulent. Within hours, Kenyans realized that the KMHFR database, the very tool they could use to cross-check the legitimacy of hospitals, had gone offline. Coincidence or deliberate silencing? Critics have not minced their words. Many Kenyans now brand President William Ruto as the chief corrupt priest, presiding over what they see as the largest organized looting of public health funds since independence.
He's the chief organizer. Okay, are we okay? The corruption in government is happening at a massive scale. Then you ask the president to crack a whip. How? This thing is happening because of him. It is the head that is dirty. Not that we didn't know he's a thief, we knew. But we thought that, umeharibiwa jina sana. Or since 97, ukiingia utafanya the opposite. But he has just confirmed the rumors that we've been hearing since we were children. So Ruto, you are the shameless thief. That's the truth. Rest in peace, Alberto Juan. One biaje wagonjwa ba na mwenye analalamika unakata shingo na ua yeye. Crack a whip on what? Wakenya, wewe unasema president should crack a whip. On what? He is the chief. Who brought SHA to us? Who? When you were complaining about SHA, who brought it? So when you say he should crack a whip, what exactly do you mean, dear Kenyans?
Duale's move, they argue, shields the ministry from scrutiny instead of exposing fraudsters. Many of them, government officials who registered ghost hospitals and have been siphoning millions of shillings through SHA. Let's remember, the whole purpose of the registry was transparency. If a hospital claimed millions from SHA, Kenyans could quickly verify its legitimacy online. That system of accountability is now gone. The disappearance of KMHFR effectively blinds the public and concentrates power back inside Afya House.
The facilities you found circulating in the social media are facilities that the majority of them were closed on the month of May. And you can check with the website of the regulator. You can check with the DHA. They were closed. Some were suspended. Some were downgraded. Mainly in number of counties. Mandera County, Homa Bay County, Kisii County, Wajir County, Nairobi County, among many other, Bungoma County, Kisumu County. If you check my previous press statement, you'll find. So what the Kenyans and social media are telling us, you are telling us information that already we have. But we want genuine Kenyans who come to us every day, who report to us every day, who have become our whistleblower, and what they tell us is exactly what our system, our forensic auditors have picked. So, good people, me and the men and women who work with me here, we have one serious obligation. We will fight fraud, and we will provide free, affordable, accessible healthcare. And I'm very happy to report that 9 billion shilling has been paid for primary healthcare. 7.7 has been paid, and 1.3 will be paid. We are just waiting for the National Treasury to release the money to the PS for him to release.
Let's start with Aden Hospital in Wajir and Pangani, an alleged ghost clinic tied to Dr. Abdi Mohammed, the very chairman overseeing SHA. Credible watchdogs revealed that in 1 month, Aden allegedly received 52 million Kenyan shillings, eclipsing what major referral hospitals got combined. SHA's books show nearly 20 million Kenyan shillings paid to a level 4 facility in Homa Bay. Critics called it a ghost. SHA shot back. This hospital has existed for decades, just upgraded, and the confusion stems from naming glitch with an abandoned dispensary nearby. Scovik Healthcare Services in Mount Elgon claims 5 million Kenyan shillings here, 3 million Kenyan shillings there. Here's how supposedly this works. Create a fake clinic, a humble room masquerading as a hospital. Siphon millions via SHA claims. When scrutiny comes, shut it down under Duale's ban.
Any facility, any doctor, or any patient to be involved in fraudulent activities will be held liable and will face the full force of the law.
No arrests, because following paper trails is harder than chasing ghosts. Then repeat, just cycle in a fresh ghost.
The Social Health Authority has suspended a total of 40 health facilities found to have engaged in these criminal activities. They have engaged in corruption.
Civil society groups, health associations like RUFA, and ordinary citizens are outraged. They say the ministry has turned off the lights in the one room where Kenyans could still see the truth. This scandal is not just about hospitals. It's about power, politics, and trust. The National Health Insurance Fund was dismantled with promises of efficiency and reform under SHA. Instead, billions are disappearing, fake facilities are thriving, and the very platform meant to verify legitimacy has been taken down. The big political question is this: was Duale protecting the system or covering it up? And by extension, how deep is Ruto's government willing to go to silence oversight when billions are at stake? So far, the ministry has not issued a technical explanation, no official downtime notice, no scheduled maintenance, no migration statement, just silence. Meanwhile, frustrated Kenyans can't access the registry, fueling suspicions that the takedown was strategic. As opposition voices grow louder, this scandal threatens to become Ruto's Watergate moment in health policy. Ghost hospitals are no longer a metaphor. They are physical proof of how weak governance and corruption can literally steal healthcare from the people. The registry going dark sends one chilling message. In Kenya, when you demand transparency, the system doesn't open up, it shuts down. What do you think? Newsroom, Maisha TV, Bushabi Jr.